I've been asked to come and speak a little bit about the ABHRS and ethics. First of all, the ABHRS was created specifically to address patient needs. Patients need to go somewhere, have a resource for high quality hair transplantation surgery. And so when this fine organization was started in 1996, that was the goal. Since that time, we've established a bar that we've set through our screening examinations for physicians who want to aspire to a higher level of patient care. To me, probably the most important part, besides having the knowledge and the skill and the experience, is that you're able to find a physician that is ethical. What does this mean in everyday terms? It means that when you come and see the physician for the first time, that you get information. You're not being sold something. You're not there as a client. You're there as a patient. At the ABHRS, we feel very strongly that you are in a medical environment, and therefore, when you come in for a consultation, you're there to get high-quality medical information. If you're not getting high-quality medical information, it's very difficult for you to make a good decision. So that initial encounter will show whether or not you are in the presence of someone who's ethical. You should be getting what's called informed consent. And again, this goes back to making a good decision based on good information. The other part that has to do with ethics has to do with patient selection. Some patients are not candidates for hair transplantation surgery for a number of reasons. Your physician should be able to diagnose you correctly prior to doing hair transplantation surgery because you need to have the proper indications for hair transplant surgery. This requires a high ethical standard on the part of your surgeon. The other part that addresses ethics is the type of surgery and the level of aggression that your surgeon has in his capacity to decide on your behalf. Aggressive surgery is discouraged by the American Board of Hair Restoration Surgery. We prefer to use conservative surgical designs, conservative surgical techniques. This reflects not only your immediate outcome, but more importantly for us, your long-term outcome, 10, 20, 30 years from now. In general, for most patients seeking hair transplant surgery, they're going to have ongoing losses as the future unfolds. And these need to be kept in the back of the mind of the surgeon as he addresses both your surgical design and the type and technique of surgery that he performs on you. So ethics is very, very, very much in the forefront in addition to knowledge, skill, and experience when we screen for our candidates. There's a lot we do that involves looking at the messages that your surgeon uses in his online presence. There's using words that aren't appropriate, like scarless or painless. That's inappropriate because it is surgery. However, because it is surgery, we can address those issues, and we address them as high-quality conservative surgeons. Should you seek out hair transplantation surgery, looking for the ABHRS seal of approval, as it may, will help guide you in your journey and is surely guaranteed to give you a much better result than going with surgeons who aren't necessarily ABHRS certified. I thank you for your time and attention, and thank you very much.